Hi, I'm Dr. with Pete's Happy Hearts. Today I'd like to talk about echocardiogram, what you need to know before the study is performed. An echocardiogram is a heart ultrasound that is non-invasive and uses sound waves to create images of the heart. This test is commonly done to evaluate the structure and function of the heart and detect any abnormalities of the disease. So why is an echocardiogram performed? An echocardiogram helps in diagnosing a variety of heart conditions, including heart defects, heart failure, cardiomyopathy, heart valve disease, and pericardial disease. An echocardiogram can detect any structural abnormalities, including holes in the heart or narrow heart valves. For heart failure, this test can help determine the extent of damage to the heart muscle and how well the heart is pumping. For cardiomyopathy, an echocardiogram can detect any abnormalities in thickness or shape of the heart muscle. For heart valve disease, this test can help detect abnormalities in heart valves, such as stenosis, which is narrowing, or regurgitation, which is leakage. Regarding pericardial disease, an echocardiogram can detect any inflammation or fluid buildup around the heart. An echocardiogram looks at the heart in real time. So how is an echocardiogram done? An echocardiogram is a painless and non-invasive test that typically takes about 45 to 60 minutes to complete. What should you expect during the test? So you'll be asked to remove clothing from the waist up and lie on your back on an exam table. And the technician will apply a gel to your chest and then place the transducer in different areas of your chest, which emits sound waves. The transducer will then send sound waves through your chest, bouncing back and creating an image of the heart on a monitor. The technician will move the transducer around your chest to get different heart views. Typically for kids, we look at 4 different views. After the test is done, the technician will wipe off the gel from your chest. There are different types of echocardiograms. The most common one is transthoracic echocardiogram. This involves placing a transducer on your chest, and it's usually done in the clinic or in the hospital. The second one is transesophageal echocardiogram. This test involves placing a thin tube with a transducer at the end in your mouth and down your throat to get a closer image of your heart. This is done in the hospital. The 3D echocardiogram. This test provides a detailed 3D image of your heart, which can help detect any abnormalities. This can be performed in the office or in the hospital. Typically, this is performed if you're requiring surgery. So what are the risks of echocardiogram? An echocardiogram is a safe and non-invasive test, and there are typically no associated risks. However, in rare cases, some people may experience some allergic reaction to the gel or the electrodes being placed on your chest. In conclusion, an echocardiogram is a simple and painless test that can provide valuable information about the heart structure and function. If you're experiencing any symptoms of heart disease or any risk factors, please talk to your doctor about whether echocardiogram is right for you. Here at Pete's Happy Hearts, you get the result on the same day. To schedule an echocardiogram, please contact our office at 406-272-2376.